Facial Bones, RAD 310, Sectional Anatomy, Bachelor of Science in Medical Imaging Program, Chris Gibbons, Instructor. Facial bone anatomy is presented in this media module. Like the cranium, sectional imaging of facial bones can be performed to evaluate for the extent of trauma, examine for masses, or aid in the diagnosis of specific bone diseases. CT is the best modality to determine for the extent of facial bone trauma since the bone window provides such fine detail. To examine for the extent of tumor invasion, MRI is often used for its better soft tissue demonstration. Now this screen image demonstrates a commuted fracture of the left zygoma on a coronal CT. These images are essential for the proper treatment of this type of complex fracture. Note the effect of this facial trauma on the maxillary sinuses and the orbit. As in the previous section, you will find it very useful in your study of sectional anatomy to develop a thorough understanding of the anatomy in 3 dimensions. Be sure to focus on the relationship between facial bones, noting articulation with other bones. It'll also be useful to be able to recognize unique bony characteristics of each facial bone. Having an organized approach to your study of facial bone anatomy will be critical to your understanding of sectional anatomy of the head and brain. The objectives for this media module are to 1. Identify and locate facial bones, including their prominent landmarks, and 2. Identify all pertinent anatomy on sectional images of facial bones. There are 14 facial bones, 6 paired as right and left, and 2 individual bones. The paired bones are the maxilla, zygomas, lacrimals, nasal bone, palatines, and inferior nasal concha. Each of these facial bones has a counterpart on the opposite side. The vomer and the mandible are single facial bones. The maxilla are paired facial bones located in the anterior central portion of the skull. These bones are the largest immovable bones of the face and are often referred to as the maxillary bones. The maxilla articulate with all of the other facial bones except the mandible. The maxillae also articulate with 2 cranial bones, the frontal bone and the ethmoid. The maxillae form the most of the floor and part of the lateral walls of the nasal cavity, most of the roof of the mouth, and part of the floor of the orbit. The lateral aspect of each maxillary bone features a zygomatic process that forms the anterior prominence of the cheek. Its inferior border is termed the alveolar process, which is a specialized spongy bone that holds the roots of the upper teeth. In the upper center region, there is a small hole termed the infraorbital foramen that transmits nerves and blood vessels. Inside the body, the maxilla contain pyramid-shaped air-filled cavities, the maxillary sinuses. At their junction with each other in the mid-sagittal plane, the maxillae form an anterior nasal spine. Study the diagram for a moment and locate all the prominent features of the maxilla. This diagram is an anterior view of the skull with the zygoma bones colored. Also called the zygomatic bones, these facial bones form the prominence of the cheeks of our face. The zygoma also form part of the lateral wall and floor of the orbit. The bottom illustration shows the more posterior portion of the zygoma, the temporal process, which articulates with the zygomatic process of the temporal bone to form the zygomatic arch. The frontal process of the zygoma projects superiorly to articulate with the frontal bone. The lacrimals are located on the anterior medial walls of the orbit. These are the smallest bones of the skull. Each lacrimal bone contains the lacrimal foramen, which transmits the lacrimal duct. Lacrimal bones articulate with the frontal bone and the ethmoid bone, and the maxilla and the inferior nasal concha of the facial bones. Nasal bones are small, thin bones located on the superior anterior aspect of the nose, forming the bony ridge. These bones vary in size and shape from one person to the next. The nasal bones articulate with each other in the mid-sagittal plane. They also articulate with the perpendicular plate of the ethmoid bone on their upper posterior aspect, with the frontal bone superiorly, and with the maxilla on their lateral aspects. Nasal bones are the most frequently fractured facial bones, so imaging of the nasal bones is often required. The palatine bones are located in the posterior roof of the mouth. The top diagram features the posterior view of the right palatine bone, demonstrating its L shape consisting of the horizontal and vertical plates. The superior portion is the part of the palatine bone seen in the apex of the orbit. The bottom diagram shows the inferior aspect of the roof of the mouth to demonstrate the location of the palatines. These bones articulate with each other in the mid-sagittal plane, with the maxilla on its anterior aspect, and with the pterygoid process of the sphenoid posteriorly. The inferior nasal concha project from the lateral and inferior third of the nasal cavity. These bones are thin and curved to form a scroll shape. Recall from the previous section that the upper two nasal concha are part of the ethmoid bones. This diagram is of the mid-sagittal plane of the face, drawn to demonstrate the vomer. The vomer is located at the midline and is a thin plate of bone situated vertically to form the inferior nasal septum. It articulates with the sphenoid bone on its superior border and with the ethmoid bone on its anterior border. The posterior border of the vomer does not articulate with any other bone, as shown in this diagram. The mandible is the only movable bone of the face. It forms the lower jaw. The mandible consists of the horizontal portion, the body, and two vertical processes called the rami. The superior aspect of the rami features two prominent processes. The posterior process is termed the mandibular condyle, which is rounded and articulates with the mandibular fossa of the temporal bone to form the TMJ. The anterior process is termed the coronoid process and is more pointed. Between the two processes is a curved depression called the mandibular notch. The palpal mandibular angle, or gonion, is located at the junction of the body and the ramus. The mandible is also the largest and densest of the facial bones, but due to its arch shape, tends to fracture bilaterally. This is a coronal section of the face, obtained at about midline of the orbits. The facial bones visible are the mandible, the zygoma, and the maxilla. Note the teeth that are visible near the bottom of the image. Recall from the previous screens that the alveolar process are specialized structures of the maxilla and mandible that hold the roots of the upper and lower teeth. In this image, the nasal bones are not visible in the middle of the orbits because this section is too deep to demonstrate them. The vomer is also not visible because it lies deeper in the skull than this section. The maxillary sinuses located in the body of each maxilla are also well seen in this image. This is a coronal CT image obtained at about the most superficial aspect of the face that you can get. The N labels the nasal bones visible in the midline, just inferior to the frontal sinuses. In the center of the image, there are three thin strips of bone visible. The middle portion is the perpendicular plate of the ethmoid, a cranial bone. Deeper in the skull, this portion of the ethmoid articulates with the vomer to form the bony nasal septum. On each side of the perpendicular plate, the frontal processes of the maxilla are also seen. This is an axial CT image obtained at the inferior aspect of the maxilla. At the top of the image, the curved structure on the periphery is the alveolar process of the maxilla, which holds the roots of the upper teeth. This structure is the palatine process of the maxilla. Here is the horizontal plate of the palatine bone. Both of these bones are visible bilaterally on each side of the faint suture line. A small portion of the mandible, the condyle, is visible towards the posterior part of this image. Cranial structures visible are the pterygoid processes of the sphenoid bone, articulating with the maxilla, and the styloid process of the temporal bone, deep to the mandibular condyles. In the center bottom of the image is a portion of the occipital bone that's not labeled. This is an axial CT of the face, obtained through approximately the middle of the maxilla. The entire zygomatic arch is visible in this particular image on the patient's left side. The right side demonstrates the zygomatic process of the maxilla most anteriorly, but the posterior portion is missing due to facial asymmetry or a slight rotation during the CT procedure. The only other portion of facial anatomy that is labeled and visible in this image is the TMJ on the patient's right side. Several cranial structures are in this image. However, since we're just talking about facial anatomy, we'll just discuss the structures that are visible in this coronal CT image. Note that this section is through the midline of the sphenoid bone. The rami of the mandible are visible bilaterally beginning at the middle of the image and extending to the bottom of the image. Also visible bilaterally are small portions of the zygomatic arches. This image is an axial CT. The facial bones demonstrated are the zygomas, the maxilla, and the mandible. The only portion of the maxilla readily identifiable are the sinuses. The mandible features different portions on opposite sides, again due either to natural asymmetry of the face or maybe a slight rotation of the patient's head during the procedure. On the right, the ramus, or vertical portion, of the mandible is seen. On the left, the coronoid process and the condyle are labeled.